kind of give an overview about the heart and cardiovascular system. So, and then we're gonna go to the next slide. I've already talked about the objective today, and then the next slide. So question. So this is gonna be our first question, and you just put. You don't have to get it right. That's why we are doing this today. Just kind of put in the chat box what is the heart and its purpose. To circulate blood. That's good. I like that. Pump organs. Very good answers. And that's like I was talking about before about heart being like a machine or like an engine in the car. The purpose is to the next slide. The purpose is to pump blood. So it's a pumping organ. And when I mean pumping organ, it pumps blood, it pumps oxygen throughout the body, it pumps nutrients. It also helps us to remove some waste. And we're gonna see a picture in a minute, but literally what the heart does, it's kind of have a pathway where it kind of pump from the right heart to the lungs, because that's where at the lungs, in the lungs, that's where we have oxygen entering our heart. And then, the oxygen enter the blood again, kind of go through out and then go back. So we're gonna see another slide where we're gonna see the picture of the heart. The next slide, please. So this is the heart. This is the heart anatomy. As you can see in this picture, heart is a pumping organ. And what happened, you're gonna see the blue side. There's a blue side of the heart. There's the red side of the heart. The blue side is typically, about the right, while the left is, the left side of the heart is the red. And what happened, you're gonna see two pipes. There's a superior vena cava and there's a inferior vena cava. And this is how the circulation happens, because when the blood is flowing, just like I mentioned before, when the blood doesn't have oxygen, it's gonna come back through the heart, because the heart is gonna help pump this blood to the lungs where it's going to get oxygenated again, and the whole cycle continues. And the superior vena cava and inferior vena cava, the two pipes here, is actually where the blood re-enters the heart. And it's going to go through the right atrium, and you're going to see the little valve there, with the arrow. That's the tricuspid valve. And then it's going to pump it through another valve, pulmonary valve, into the pulmonary artery, and then it went through the lungs and get that oxygen that we need. And then it's going to re-enter. As you can see in your right side of the computer, there's going to be pulmonary vein. So that's where it enters the body. So when it enters, it's going to go through the left arterium. There's going to be mitral valve, and then it goes through the left ventricle, very thick side of the heart, because that's where it's going to put that pressure from the heart through the aortic valve, through the aorta to the body. And we are talking about this because all this is important. As you can see, the pathology, or if you will, the disease of the heart happens sometimes when any of these things is not working well. It could be the valve. It could be maybe there's some ballooning, that means dilation of the heart, of the chambers, or maybe there's a constriction. So when we have all these issues, that's when we start developing heart issues. And as you see, the topic today, we are talking about cardiovascular issues. So there's a heart, all these vessels. So heart is cardiac in a medical term, then the vascular is the vessel. So as you can see, there are some vessels going in, whether it's artery, vein. So those are components, we call them cardiovascular system. We can go to the next slide. So we're gonna talk about conduction. I'm glad this slide pop out, because how does this even happen? Like, the heart just contract or pump or whatever. How does this happen? We gotta think about the conduction system. And like I use analogy of a car engine. Heart is like an engine, and in any engine, you gotta list some electrical. And, when you have some electrical issue in your car, usually a bad one. And the electrical issue in the heart is called the conduction system because that's where the firing happens. This picture, we can talk a lot about this picture, but one thing I want you to know is just the electrical activities that help us to pump this blood, to keep it. It's just like the generator that happens that keep that heart pumping, boom, 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 boom. And we have some nodes, like you see the SA node, the AV node. Literally, all these are what I mean, those are firing system. And sometimes when one doesn't work, the other ones want to take over. We want SA node, which is called sinoatrial node, which is the one in the upper left side. That's what we want to be generating our heart. Now, when it's not doing it right, then other AV node will take place, maybe bundle branch. But then that SA node we refer that as the peacemaker. And when it does its job, we are firing around maybe 60, 80. Some people will argue 100. But that's the what we want to be generating our heart. And when it's not doing its job well, then maybe other people have to keep working, and that's when things go bad. So this is a conduction system in a nutshell, and we're gonna look at the next slide. As I talked in the previous slide about the cardiovascular system, you see the heart. This picture is very nice picture of anatomy of the heart. You see all these vessels. Some are red, some are blue. The red one shows the one that have the blood with oxygen, because the oxygen, when the blood have oxygen, is usually we denote it by red color. It's a good blood. When it's blue, that means it's probably need to go back to the heart to get refuel. So this is the cardiac. This is what the heart does in a nutshell. It just go through our body system. And that's why we're talking about the heart and the structures organ, which is the vascular, and that's the cardiovascular system in a nutshell. And we're going to see the next slide. So we're going to talk about cardiovascular disease. So that's the pathology of what goes wrong. I mean, if heart goes wrong, a lot of things goes wrong. I was talking about earlier about how heart controls a lot of things, including the brain. And when there's no oxygen in the brains, most of the time, most of the stroke is because we don't have enough oxygen. So we're gonna talk about the diseases of the heart, which is I'm saying the slide, the last slide. Yeah, so we're gonna talk about the coronary artery disease, and it's important because heart itself needs fuel. So we're gonna talk about that, and when we get to that slide, I'm gonna tell you a little bit, because it's very huge how this is important, that the heart itself have enough oxygen that it needs to work. Then we're gonna talk about congestive heart failure. That's very important because when our heart fails, a lot of things go wrong. I mean, we all have other things that can go wrong in the heart. We have peripheral artery disease. We have atherosclerosis, which is more like aneurysm. That's what we hear. We have cardiomyopathy, which is when the heart is dilating or kind of ballooning out like a balloon, or maybe getting constrictive. And we have the valvulitis, which is mostly it means the inflammation of those valves. Those valves I was showing you earlier. When it goes wrong, we have issues. So those valves need to be working. Then we have the pericarditis, we have arrhythmia. Arrhythmia too, we talk about conduction system. So arrhythmia means when the heart is not beating the way it's supposed to be. When the wiring is not wiring the way it's supposed to be, that's arrhythmia. And there's a lot of issues that arise from that. So we don't have time to talk about this congenital heart disease and so on, but we're going to tell you about coronary artery disease and congestive heart failure. Now, why are we talking about this today? I mean, at BPOU, Black Physician of Utah, we want to bring you important topics. We want to sensitize on what affect our population because there's so much to talk about in medicine. But being able, as a Black person, being able to know what is an issue or what disease that we could maybe do something about it, which is the heart issues is a big threat to our population. But it's important that we knows about it, and so we'll be able to hopefully do something to mitigate that risk or reduce the risk of having this issue. Now, the important fact to know is that Black or African American are greater than 2 times, so 2 times likely to die of heart disease than Asia and Pacific. I mean, we are 2 times more likely to be died of heart issue, and that's why we're talking about this. It's also important to know that 40% of Black adults in US have hypertension. And hypertension, we're going to talk about it too. We have a slide to talk about hypertension because we are just telling you about the important things we need to be aware of. And we can talk about heart issues without talking about hypertension. I mean, it affects, if we are 10 here, 4 of us have hypertension. That's what it means that a lot of us here have this issue, or maybe our family members are dealing with this issue. Then we're gonna talk about Black men having more mortality, than white men, and of course, I think another thing that stand out is Black women. They are more likely to have hypertension at a younger age. So, being a Black African American or Black woman, you live very high chance of having a hypertension even when you are in 20s or 30s. And it's important to know that. We're gonna go to the next slide. So, cardiovascular death by race. So, this is a picture. It's just like I said, it's just telling us, as you see down the slide, Asian, Hispanics, we're comparing death per 100,000 persons. And death per 100,000 persons, as of 2017, maybe in 100,000, 85 people, 85.5% will be affected, or they will die of heart issues. Why in Black people, it's about 208. That's more than double. Even when you add Hispanics um, to the population and you do the math, like it looks like our issue of heart disease is kind of almost like times double, even comparing those two populations. And we can go to the next slide. Heart issues, that's exactly what we've been talking about, is the leading cause of death in United States. I mean, we are talking about, it doesn't matter about race, it affects us in the most, but it's still the culprit of more people die of heart disease than cancer. Even the COVID, during the COVID, I mean, we have a lot of graph that shows, but even during the COVID, people were dying. People were dying so many. Still, the heart issue was still the highest cause of death. So that's very huge to know that even cancer and all that stuff, even stroke. I mean, we all worried about stroke. We hear it all the time, but you can see from the graph that the heart issue is a big deal. And we can go to the next slide. So coronary circulation. So I was talking earlier about, heart being a car engine, and then, engines still need work. I mean, even when we have issue with our car and it's gonna be engine problem, I mean, we don't feel good about it because Sometimes you might have to get a new engine, and sometimes it's gonna cost you a lot of money. That's almost the same thing with the heart. I mean, when things go wrong inside the heart, I mean, I rather, if I have option, I rather break my leg and get prosthesis than having a heart issue. I mean, it's just how it is, and the circulation that happens when this heart doesn't get oxygen that they need to function. When the valve is not working, when I mean the coronary circulation itself is talking about the blood circulation in the heart. So when it's not getting enough oxygen, that's when we have what is called the heart attack. Myocardial infarction or heart attack. Everybody here must have heard about heart attack. That's literally when you don't have enough oxygen supplying the heart itself. And we're gonna go to the next slide. Now, another quiz question. Well, I think I've answered this. So coronary artery disease. Okay, what is coronary artery disease? Okay, no. I mean, we can answer this. I mean, go ahead and put in the box in the message what you think. We have been talking about coronary circulation. What is coronary artery disease? That's right. Plague in coronary artery. I like that. I like that answer. I like that answer. Okay. So, as you can see, the arteries supplies the heart. And when we have any blockage in those circulation, that's when we have coronary artery disease, or maybe they are constricting, the oxygen is not going well, it's not circulating where it's supposed to be. You're gonna see the picture on the right side, and you're gonna see where there's some fat, and the blood vessel is almost completely obstructing. And that picture there is actually what you see when a patient have heart disease. Most of the time is about the fat, the fat, which we call atherosclerosis. I mean, constricting. I mean, any other thing that could happen could cause it. Sometimes it could be dilation of our artery vessel, it could be dissection, that means it's break. But for the most part, it's actually when those constrictions kind of get so tiny that the body is not getting supply, especially when I talk about the brain, the stroke. If you can't get blood pass through that little vessel, then we're not gonna have enough blood in the brain. And what happens when we don't have enough blood in the brain? We're gonna have some ischemia, which is typically a type of stroke. So, and I'm gonna give you a picture, when we have a chest pain, and I think is important to highlight when you have a chest pain. So chest pain itself, we call it angina. It's kind of medical term of chest pain. So some of them is very common that people that will have some heart attack, some of them will have this chest pain. Now, when you have a chest pain, and then it doesn't get better, or you start having a chest pain and it's so hard, I mean, you're having sweat. It might be if you or your family member, you hear anything about chest pain, you might be worried about, and you can go to ED, maybe let them prove you along that it's not a heart attack or something like that, because usually the chest pain that don't get resolved, with maybe within 10, 15, 20 minutes, we are worried about heart attack. And sometimes we're going to have heart attack, and sometimes we have a big damage. Sometimes it doesn't, but it's good for us to check it out so that we'll be able to remediate damages. And usually you have those you start having a chest pain around 60% of occlusion, I mean 60, 90%, but then after that, you're probably gonna have that 90% occlusion, you're gonna have heart attack. So the earlier we know about these issues, the better we are able to we have medicine that can we go in, we kind of get the vessels, we kind of do something about it. So it's very important to know, to be aware of that. Next slide. So hypertension. So hypertension, as we all know, it's very common. A lot of us, 4 out of 10 have it. It's good to know the range. At what point we call it a hypertension. We have a systolic, we have diastolic. So as you see the two numbers, whenever you check your blood pressure, there's gonna be a number, a high number, and the low number. Now, this is a perfect 1/10/70. I don't even know if I have that, but we want to be around that area because that's a smiley place to be. Now, when you are getting old, maybe you're not gonna be this good. Maybe you need some medicine to help you. But I just put this number to be aware when you check your blood pressure. It's gonna be around maybe 110, 120 or something, or 100 plus. That's a happy place. Now we start calling it hypertension when it start kind of going above 130, or maybe the lower side is going above 80. That's when we start getting worried. Now, heart failure, very just like it sounds when the heart fails. A lot of things happen when our heart fails, and there's systolic heart failure, there's diastolic heart failure, there's congestive heart failure. We don't have time to go into it. We can talk about heart failure till tomorrow, but the important thing to know is that when the pumping, we talk about heart being a pumping organ, and when they are not doing their jobs, what happens is those blood they keep pushing out. They're not gonna be able to push them out. The blood start backing up. I mean, they start backing up fluid because blood is a fluid, or at least is a lot of components of blood are fluid. So when the heart is not pumping, there's gonna be fluid backup in our body, and we are talking about the lungs. That's why sometimes you're not gonna be able to breathe. You are talking about liver. We are talking about, I mean, it's seriously, we have, it's all about when the heart, the pumping fails, the fluid is everywhere. And that's when we have the symptoms of what we classified as heart failure, congestive heart failure, because we cannot have the heart circulate the blood where they need to be. So they are everywhere. And that's what heart failure is. And it's important that we be aware of that, and so on. So next slide. So it's important, and I think that's why this topic is important, because it's good. We can know that something is happening, but are we really able to do something about it? And when we're able to do something about it, or even kind of remediate the risk or modify it, that's when it's become an advantage to us. And that's the purpose of talking about this, because we can talk about heart, but then we don't really know. I mean, are we gonna be able to help it? No, maybe we're gonna die. Well, I hope not. But in this heart issue, we have things that we call modifiable risk factors. And what that means is if we are able to modify this, we're actually going to reduce the risk of heart issues in our population. And the first number one is cholesterol. As we talk about the atherosclerosis, or what usually blocks the vessel is the cholesterol. So the cholesterol, if we are going to keep our cholesterol in check, that's gonna be a way to reduce our risk. Then we have the blood pressure. We are talking about it because the pump, you don't want it to be pumping too high, right? So when you start pumping too high, a lot of things can go wrong. So if we have this high blood pressure, we are able to keep it pumping good, then it's gonna be fine. Then smoking, we all know smoking is not good for you. Yeah, please, if you smoking, kind of constrict the vessel. A lot of things go wrong. I mean, we're talking about heart today, but there's a cancer. There's a lot of things in cigarettes. So it's really something that we can work on, and it will reduces our risk. In activities, we all know that physical exercise is good. I mean, it's recommended if you can do 4 to 5 days a week, 30 minutes physical activity. Whatever it is, running, whatever, it helps so much. Obesity, We know the more we lose weight, the more the heart is able to pump very well because there's less place to pump. And we have diabetes. Diabetes, it's like a comorbidities, which means when you have a diabetes, your risk of having a heart issue is huge. As a matter of fact, there's a recommendation if you have a heart disease, even when your cholesterol is kind of a little iffy, you just go ahead and start taking cholesterol medication because now we have a heart issue, we have buildup of cholesterol, that is bad. So there's a medication called statin. If you have a diabetes here and you feel like, you might talk to your primary care to know if you're gonna get started on something because that's not good when you have diabetes and you still have cholesterol. So it's something we can do something about it. Then stress. Oh man, stress is something that, oh man, it affects a lot of all everything in your body. I mean, when you are not feeling good, when you feel depressed, a lot of things go wrong. I mean, the cholesterol, I mean, the cortisol, there's a lot of buildup that happens. I mean, we want to mediate stress as important as possible. And the good thing is at BPO, you will have a mental wellness that we actually, have a program here at BPOU that we actually try to, help with the stress awareness and so on. So check it out. Diets, well, we know vegetable, low salt diet are so good. Then this is unmodifiable. And since we don't have a lot of time, I mean, I could talk about it, but I mean, does it really matter? Because we can't really do anything about it. We're gonna be old. I mean, if we are male or female, what I mean is in biological sex at birth, because it determines the hormones, the body proportion, the fat distribution. So the sex at birth can really, can we heredity if if we inherit something from our parents, we're not gonna do something about it. But it's important to know that, the other slide actually talks to us about what we can do, how we can help. This is what we can not only change. We can change the fact that we are Black people and we already have inherited a lot of risk in, being able to die of heart issue. We can change that, but we can modify, we can work on some to mediate those risk factors. And the other slide. So this is health disparity. I'm gonna let Dr. Jones take it from here. Dr. Jones has been a physician, like I mentioned before. I mean, she's been in public health. She's been a faculty. I mean, she taught medicine for almost 20 years. And the importance of, her career, she actually have done a lot in public health. And she work in this population. She's gonna tell us a little bit about how those affect us, in particular the Black community. Thank you so much. I'll give it back to Dr. Jones.
Thank you, Jude. Thank you for that presentation and helping us to understand the science behind heart disease. And we do know that heart disease is the #1 killer in the United States for everyone overall. But unfortunately, people of color, specifically Black and African American people, have the highest rates of death from heart disease. So let's talk about why this disparity or difference. So I just wanted to go ahead and refer back to this one slide. It just lets us know that Black people have the highest rates of death from heart disease in the United States. And Black people are dying from heart attacks. So why? Well, studies have shown that we have structural racism in the United States, and this affects our health. So what structural racism is, it's methods that foster racial discrimination in a society. For example, with regard to housing, education, employment, earnings, benefits, etc. And so these practices and patterns reinforce discriminatory beliefs, values, and distribution of resources. So this is what structural racism is, and it affects our health. So quiz question, what are some social determinants of health? What are some of those factors in our society that influence our health and well-being? So if you want to take just a couple of moments to, sorry, now I'm pushing the wrong button. You can take a couple of minutes to add to the chat. Excellent. Excellent. I love some of these answers that I'm seeing. Economic stability, food. Yes. Excellent. Those are wonderful answers. So social determinants of health are some of those things. Our economic stability, the physical environment where we actually live and spend the most of our time, our education attainment, our access to food, specifically healthy food, community support, and healthcare system access. All of that, all of those are determinants of health. And as you recall, the definition of structural racism are methods that foster discrimination in a society. And so these are methods that foster differences between people of color and other people with regard to these factors here. And so structural racism influences our health. It influences the social determinants of health, and it influences our health overall. So economic stability, overall, people of color continue to face barriers with regard to employment opportunities. We have a lower medium income compared to white counterparts, and we are more likely to be unemployed or work lower paying jobs. And this is historic. Slavery, Jim Crow, etc., legalized occupational discrimination through the 1960s in the United States, and we're still seeing repercussions of that. So our low economic stability is associated with our poor heart disease or poor heart health. So physical environment, where we are actually living. I mean, historically, there was red zonings. And so the National Housing Act back in 1934 legalized residential segregation and discriminatory practices. So in the 1930s, it was legal to say that people of color could not live in a healthy region. And this continues to affect where people of color live in the United States today. Overall, under-resourced and unsafe neighborhoods with high levels of pollution, that is associated with poor heart health. Education, this goes back to slavery, Jim Crow, all of that legalized educational discrimination in the United States through the 1960s, or, in the 1960s, that's when things were turning around. Of course, the Supreme Court ruling in 1954 made racial segregation in public schools illegal, but the repercussions of that continue. People of color continue to face barriers in educational opportunities, and lower education attainment is what we see in people of color as compared to our white counterparts. And this low education is associated with poor heart health. Food security is actually reliable access to sufficient quantity of affordable and nutritious food. If we have low education and low economic stability, then these are barriers to having access to nutritious foods. So food insecurity is also associated with poor heart health. Community support, having positive social networks is important with regard to our health. However, people of color have lower social capital. They have some social capital, but that social capital is not always positive. And people of color have smaller social networks just in general. So overall, just not having a high quality of community support or social capital, this is associated with poor heart health. Our healthcare system, if we don't have access to healthcare, including insurance, transportation, communication, etc., and if we don't have quality care, then we have higher risk for heart disease. And people of color have lower quality and access to our healthcare system. So overall, please recognize that heart disease is the #1 killer in the United States. Racial disparities are present in the United States with regard to heart disease. Structural racism influences social determinants of health, and people of color have many social determinants that are associated with poor heart health. So it's going to take collective action from individuals, communities, healthcare systems, policymakers, etc., to change this. Overall, hopefully, as you go away from this presentation, you'll not only understand the importance of heart disease, but perhaps you can think about how we can be a part of disrupting this disparity in heart disease. So thank you so much for taking some of your time with us this evening. I'm sorry about the technical issues and everything. We do have references. Please contact myself or Jude if you'd like to talk about this issue more. And of course, um, we want to be open to questions. However, we are also cognizant of your time, and we are at 7:30 on the dot right now. So please contact either myself or Jude if you want to speak about this further. Contact BPOU as well. And we hope that you continue to support the Black Physicians of Utah. Next month, we do have, and I'll be a part of once again, a celebration of women's history. And this is the Her Story, Our Inspiration, Black Women in Healthcare. And so I'm looking forward to that presentation next month, and hopefully you will be able to join us. Thank you, everyone.
Thank you again, Dr. Jones and Jude, for the very enlightening session. Like Dr. Jones has said, please feel free to check out the websites bpou.org. There are lots of events that come up monthly, and it would be nice to have you even in the physical events. Thank you, everyone.